Good day, good evening, everyone. Hi, I'm Makia Majrashi. I'm a senior patient safety specialist. Dear participant, kindly notice that the questions will be at the end of the session, and you can post them in the Q&A icon. So our speaker will answer them gladly. You will be hearing a presentation from Professor Samia Al-Amoudi. She will be speaking to us about Health Empowerment Initiative role in patient safety and patient advocacy. Prof. Samia, she is a consultant of OP, founder of Health Empowerment Initiative and Health Rights, Faculty of Medicine, King Abdulaziz University, Health Empowerment Consultant for Saudi Commission for Healthcare Provider Specialists. Without further ado, let us start our exciting session with welcoming Professor Samia Al-Amoudi. Professor Samia, the mic is yours.
Assalamu alaikum. Thank you so much, Makia. First of all, thank you so much for the Patient Safety Center for hosting this webinar and giving me the chance to talk to my colleagues from different areas, different sectors about health empowerment and the relation to patient safety and advocacy, and what's our situation in Saudi Arabia. Many people, they have sometimes not clear picture about women's empowerment in general in Saudi Arabia and women's health empowerment in particular. Being myself a consultant obstetrician for over 30 years and being a breast cancer survivor as well, and being a mother and a female. So all these things, they are extremely important for us as advocates and in empowering other people. Let me start with the first slide. Okay. It's not moving. First slide, yeah, Makia.
Can you, doctor, just press next?
Okay, I'm pressing, but it's not moving. It was moving before. Maybe something is wrong from your side, the technician. Right, let me.
Our IT support, do you have anything to support us with this freezing slides?
It's not moving anywhere. Sorry for this.
It's
this
okay,
is why...
doctor. You can just.
Yeah. I always say the technology, this technology is really great advancement, but it drives you crazy sometimes.
Yeah,
okay.
I totally agree. We are thinking that it's gonna helping us, but sometimes it's really surprising us.
Everything is just freezing, it's not moving. So, any help, please?
Okay, would you like that we can stop sharing now and you can just check the PowerPoint again, if you would like to.
Right, trying to do this, stop sharing. All right.
Okay.
Okay, let me go back and share again. And right. Okay. It's not moving.
By the arrows, doctor, you can use the.
Yeah, I'm using the arrows as well. Yes, I'm trying to use this. Let me go back. Screen has stopped. Okay, right. Right, advanced. Okay, do you see the slides now?
Yes.
Right.
If you can just try.
Yeah,
with full screen, fine.
This is the full screen. It's not moving. Okay, this is full screen. All right.
Great.
Right. Okay. Thank you so much, Makia, and sorry again, my colleagues. Now, I'm going to talk to you about the story of health empowerment initiative in Saudi Arabia. First of all, there is a poll that we would like to ask you. Makia will take over just to have an idea. It's not a pilot study. It's nothing, yani. It's not a paper, but just to know what do you understand from the definition of health empowerment. Okay, Makia, go ahead, please.
Yeah, Doctora, it is already launching.
Yeah, I can see the percentage. Mm-hmm.
You're gonna give them few seconds.
Sure.
We are having 300 plus participants only. Until now, 50% of them are participating. We need more. A lot of debates, Doctora.
Mm-hmm.
So from your own perspective, patient empowerment is the facilitation and strengthening of the role of those using service as co-producer of health and healthcare policy and practice, or the process of preventing patients, their families, and their carers to become active in the management of their own care, or to give less power to individuals or groups, increasing their capacity to make choices and transform choices into actions.
Right. Well, it's surprising and not surprising to me at the same time. 63 or 62% only, they've got the right answer, the correct answer, which means that the 39 and 6%, which is about 40% of those who are attending, the 50% who have answered, they got the wrong answer, which proves again and again that we still do have a problem with the conception of empowerment and health empowerment, which is there in our country like in other countries. It's not only in Saudi Arabia. So these are the results. Okay. Can I move now, Makia, to the next slide, please?
Yeah, sure, Doctor.
Okay.
Yeah.
Let me close the Google and again, what's happening? Right. From our side in Saudi Arabia, for those who are with us, just usually I like to put this slide in all of my presentations, even when I'm teaching medical students, because I teach 4th and 5th and 6th year medical students about the health empowerment. This picture, this royal decree, it summarizes the situation in Saudi Arabia and the great reform in women's empowerment and women's health empowerment or health empowerment in general. This is a decree that was issued by a custodian of the two holy mosques in 2017. And this royal decree, I always say, its number is easy to remember. Everyone in the community, everyone healthcare provider should know about this royal decree, which is number 33322 issued in October. It focused on empowering women. It focused on spreading the culture of health rights in the society. And of course, the women's rights are many. There are the economical rights, the social, name it. But for us as healthcare providers, whatever the sector we are working on, it's the health rights that we are focusing on, because if you do not enjoy your health rights, you cannot enjoy any other rights. Prince Mohammed bin Salman, His Royal Highness, the Crown Prince, we always say he's the godfather of empowerment, of reform, and of the vision, Royal Vision 2030. And this will show as we proceed and tell you what's the story. Why I'm telling that it's a story? Because I've graduated in 1981 from the Faculty of Medicine at the university. We were the first batch to graduate. Why I'm mentioning this? This was a long time ago to show you that at that time, there was nothing we know about health rights. We don't know about the policy and the legal aspect. We don't know what's the concept of health empowerment. It wasn't there. So this shows you how we moved from 1981 to 2020, where today we are discussing health empowerment everywhere and patient empowerment everywhere. I will tell you as well about how the health rights were viewed in Saudi Arabia, but they are not the real situation nowadays. In the past, in the 80s, they used, for example, the consent form, people were not taking consent form sometimes from the patient. They will take him or take her to surgery without consent form. Sometimes the family will tell the surgeon or the physician, well, don't scare him, we'll take him, then we will explain to him. And I will tell you stories, a lot of stories, how this health right was not understood at that time. And after that, when I was diagnosed to have breast cancer, I am breast cancer survivor twice. The first time it was in 2006, the second time it was in 2015. It's at that time that I found that although I'm an obstetrician and consultant and whatever, for me, myself, I was not aware of my health rights. I did not have the empowerment that I should have as a patient. That was the time when I started to write my story in the newspaper. I published a lot of books to break the silence, and we started to empower women about all these issues. Empowerment in a very simple way. Until now, people do not know what is empowerment exactly. And as we said in the poll, 40% they did not give the accurate answer. It's in a very simple way, is that I give you the power of knowledge, and I give you the information that increase your capacity so that you can share in decision-making about your health issues. And it's a very significant concept for women. I'm focusing on women more than men because most of the problems comes in the issues with women. And when you assess the empowerment in your society, you can plan your strategy. Like the Patient Safety Center now, they are planning their strategies and their webinars, their programs based on the need assessment that they are doing. Health empowerment as well, for us here in Saudi Arabia, it's assessing is one of the key themes of the new model of care. And this is evolving in Saudi Arabia. When we come to patient rights, usually in the past, we used to say, oh, this consultant is a very good consultant. He's taking care of his patient, explaining their rights. Nowadays, people are not the same as they were 30, 40 years ago. I keep telling my students, Faculty of Medicine, or even the nursing student, that be careful. The lady who sit in front of you in the clinic is not the same lady that I used to have. It's not the same patient. In the past, the patient will accept whatever you say. Today, patients are aware. The young generation, they know their rights. And it becomes by law that you should understand and you should empower yourself before you empower your patient so that you can avoid having problems, legal problems, so it is by law. Another issue in the Western countries and in the a lot of organizations, they think that in Saudi Arabia, women, they don't have the right there is nothing called women rights or health rights. Maybe it was in the past, but unfortunately, what we do not know, and this is why I started to be interested in this issue since I've graduated. When I did the search, I found that it's the contrary. In the basic law of Saudi Arabia, in the basic law, long time ago, the basic law in Saudi Arabia, it states this and emphasizes that healthcare is provided for every citizen in emergency, sickness, disability, and old age. Maybe we were a little bit late in providing patient bill of rights. It was issued from the Ministry of Health in 2006 and updated and revised in 2019. And I was involved in two parts, the reproductive health rights for women and the cancer patient rights. But we do have now bills of rights, and these are one of the tools to empower patients. And anyone can go Google this, Ministry of Health, patient bills of rights, and he can have it. Another issue, like everything in science and in medicine, we wanted to know what's the real practice and what's the real concept and the knowledge of our student. In a paper that we published, it was surprising that until this minute, until this recently, so far, the students, medical students, they thought, for example, the female right to sign consent for surgery, only 40% they know that she has the right. The majority, either they don't know or they think it's the legal guardian who should sign on behalf of her. And this is happening until this minute. But of course, in the last 5 years, since we have started to empower people, this number have changed. Unfortunately, we do not have many studies about health empowerment or health rights in Saudi Arabia to compare, but from what is available, we do seem to have a problem. The healthcare providers, they have weak knowledge about the legal aspect, about the rules, the regulation of the Ministry of Health, and the community, the women themselves, the men as well, they do not know about these rights. Why is it important then to know about all this, what we are talking about? It's a very simple answer. This is a case which was the case that drew my attention since I was a resident and I've started to dig in this information. It was a lady who came in labor in one of the biggest hospitals in Riyadh. That was in the 80s, and this paper was published in the Saudi Medical Journal in 1985. A lady came in labor. She was pregnant. That was her third pregnancy. And the doctor found that the baby is in transverse lie. In obstetric, when the baby lie in transverse lie, not the head presenting, there's no way to deliver that lady except by cesarean section. The baby cannot get out. At that time, they used to have the consent. They think the healthcare providers, not only the patient or the husband, they believe that the husband should agree. The husband should sign the consent form. During the discussion with the husband, he refused to sign because up to his knowledge, she delivered twice before normally. Why should you do cesarean? Why should you rush? Give her time. During discussion, which took around 2 or 3 hours, the patient went in obstructed labor. She ruptured her uterus. The baby died, and the mother died. Perinatal mortality, fetal mortality, maternal mortality is a serious issue. This is what we are talking about, patient safety. This is the core issue of patient safety. You don't want to end with morbidity or mortality. So that was the case. Now, until recently, some of the hospital, they still insist, but it's not like before, definitely, especially in the last 5 or 6 years. It's not only in obstetric and cesarean, like, for example, one of our patients who was breast cancer, and the oncologist have to give her chemotherapy. The husband refused and took her outside the hospital, and he his belief was that the chemotherapy is killing, and he signed a discharge note, which is not his right. The patient came after a couple of months with metastasis, and she passed away. So there are many things for male and female that need to be clarified to the patient, to the family, to the healthcare providers for the patient safety. And this is what we say when we say health and patient empowerment intended to support providers, which are us, the healthcare providers, to minimize patient safety incidents. We don't want to end with metastasis. We don't want to end with ruptured uterus, and drive improvements in safety and quality. And this is part of the system, which we have to make sure it's established in the operational system to minimize errors. Now, patient engagement is another issue. And I remember when I had breast cancer in 2006, maybe because I'm obstetrician physician, so those who are taking care of me, my physicians and whoever is involved in my management, because I'm a doctor, it's a bit different. I have the knowledge. Of course, I'm not oncologist, I'm not breast surgeon, but I noticed that still there are lack of engagement in certain areas with the patient. And this is extremely serious because you have to involve the patient and their family in decision-making. Decision-making is the right of the patient himself or herself, but there are other issues that should be we should engage all of these so that we can improve our system. We can avoid errors, etc. Like in the elderly, if you have an elderly patient, you have to involve the family. Maybe he has Alzheimer, maybe he cannot remember the medication, the time of the medication, the appointments. So engagement is a cornerstone in the management process of the patient. The main objective is not only that we teach the others or increase awareness about Ministry of Health regulation and rules. No, we are supporting the rights because we don't want to have morbidity. We do not want to have mortality. We do not want to end in error. This is patient safety. And it's not only we are not doing this only to protect the patient. You who are listening to me now, a healthcare provider, whatever your area of work, it's our job to empower you so that to protect you from medical-legal problem. Because nowadays, if something went wrong with the patient, she will sue you. If you follow the correct law and regulation and you know what are the rights for you and for the patient, you will be on the safe side and you will not end with problem. But if you are ignorant about this, then you will be in trouble. And this is why the Patient Safety Center and we in our program and the initiative Health Empowerment, we empower the healthcare providers, the students who are going to be the healthcare providers in the future, near future, and we empower women about these issues. Islamic rules, people think that this is Islam. This is the way they treat women in Islam, which is completely wrong. The higher authority of scholarship, for example, in Saudi Arabia, Fatwa al-Ulama, since 1980, it was, and before as well, clear that the mentally sound adult woman, we usually talk about adult because in Saudi Arabia, 18 years, this is the cutoff point. And if the patient or the lady less than 18, here, yes, the legal guardian is the one who will take the decision or consent the agreement. But still, what's beautiful in Islam, he has this right, provided it's not against the well-being of the patient. For example, if you have a boy come to you 14, 12 years old in the emergency bleeding, and you have to take him for surgery after, for example, a car accident, you will take the consent, for example, from the father. If he refused the operation or if he refused blood transfusion, and you think that the minor will be jeopardized his health, his organ, or end with death, then there is no, it's not acceptable. We do not accept the refusal if it's against the benefit of the patient. And in this case, we need two consultants to sign, and we have ethical committees in the hospital. This is to protect the safety of the patient. Most of the hospital nowadays, they have ethical committee. We teach the ethics, we teach the rules, we teach the regulation for the minor, for the adult, etc. In case of emergency, it goes without saying, many of you, they know that as well. If the patient is in coma or there's nobody around, in emergency, you don't need to have somebody to sign for the consent if you are going to save life or organ for that patient. During the pandemic, which happens, COVID-19, it was as well, the last 2 years, it was special and unique everywhere in the world. We faced with a lot of problems which are related to patient empowerment, to healthcare providers empowerment. For example, we have certain categories like those who are disabled or elderly or in the shelters, whoever, they have rights. They have to be empowered. And the healthcare providers as well, they do have rights so that they can protect themselves. So there's everybody was working on these issues and the right to be protected from violence as well. This is why the WHO, when the definition of health, it's not only the absence of disease, that you are healthy or not healthy. No, it's the health, the mental, psychological, emotional, social, and the physical health. Violence, not necessarily that you end with broken bone, but even the insult itself, this is against the patient safety. And this is why we have to empower women, men during crisis on how to behave during these crises. Next week, 2nd of February, Noura University, which is the biggest university in Riyadh, I'm going to share with them in a big conference, and I'm going to talk about women health right during global crisis like this one. So this is the empowerment that we are working on. Now, what are the tools? You will ask me, what are the tools that I can use so that I can empower myself or empower my patient? Everything you can imagine. One of the things for me, I like writing, so I have published few books. I'm a big fan of Twitter and the social media. I use it as a strong tool to spread the knowledge and empower the people. You have Facebook, you have webinars like this one, which is a major step in empowering patients. And even the young girls in the school, I always focus on the young generation because I believe that advocating for women's rights and forming health empowerment ambassador is a big step. We have, for example, in our Faculty of Medicine, we have what we call health empowerment ambassador. We do workshop for them, we train the trainer, and they go in the malls, everywhere, they will empower other patients because this is one of the tools that we can use. Then we come to the future of patient safety and advocacy in Saudi Arabia. I put you remember the picture, this one, and This is where there is a big movement and big reform in our country. And this is where the vision of 2030, it includes the quality of life, the safety of the patient, the health rights, and of course, the treaty and the international agreement. All of these, we emphasize on that. This is what we are doing currently and doing for the future of our patient. In 2016, I've initiated the Health Empowerment Initiative as an initiative at King Abdulaziz University, and one of its outcome was a unit of health empowerment and health rights. And this is because we believe health rights are basic human rights through which we empower the healthcare providers, women, men, etc. At the level of the policy maker as well, Shura Council, one of our colleagues, Professor Muna Al-Mushair, she is the head of the health committee in the Shura. In 2016, they have applied to what they call it, 2 parts in the law, so that the council adopted the Shura resolution, Women's Health Program, and the development of Women's National Health Program in the same law. So they focus on women, not only during the reproductive years, but since birth until the end of life. Of course, you know about the health, the Sustainable Development Goals. We are lucky that we managed on low scale, which is expanding now, that for good health and well-being, we are in our department, for example, we have initiated what we call Pregnancy Health Empowerment Clinic and Cancer Patient Reproductive Health Rights Clinic. This is to empower women medically, legally, socially, and reduce morbidity and mortality. Not only that, but the quality of education. We've managed to introduce health empowerment in the curricula, and we were fortunate to present it to the faculty as well, to the committee of deans of all the college faculties of medicine in Saudi Arabia, and they have approved this one, and it was in the agenda. Then they were impressed by what we have done. And the same thing in the Arabian Gulf universities. In Kuwait, we discussed in the GCC our program. Unfortunately, we did not move faster in this area because of the corona. Everything have stopped. And what we work on as well is the non-medical faculties, because these are the women, these are the men that need to be empowered, need to know about the patient safety, how to protect themselves. Gender equality is extremely important. And this is why I focus in my books and publication, like this book, it's the girls' empowerment, socially, medically, and psychologically. And we try to have connection with the policymaker, although the system and the rules that women can consent for themselves is there since the 80s, but because people, they are ignorant about it, now, every now and then, the Minister of Health, they will distribute and emphasize that there is no need for the consent of the husband or the father, as well, because of the as I told you, the royal decree from King Salman that was issued in 2017, saying that woman empowerment and health rights should be known in the whole sectors in the country. Lastly, one of the projects which we feel very proud of which we did in Faculty of Medicine, King Abdulaziz University. We had a collaboration with the Saudi Society for Health Specialization, and this is a learning program. Those who are under the trainee and those who are in the category of following the in the program of the Saudi Health, they can join this one, the e-learning program, and it's very rich about many things to know about how to get started, what are the health empowerment, what are the policies, how it interact and process with the ethics, patient rights, the children, the youth, the female, the male, the elderly, all these are there. Lastly, one of the great message that I always believe on, start with the grassroots. You might not be able to change adults, but the real start is here with the young generation. Don't underestimate first of all, don't underestimate yourself. One person can change the world. The other thing, empowering girls is the key for change. This is the last slide. And again, we go back to the poll with Makia. And I hope that I did not take long time. I wish, inshallah, that you get a clear picture about health empowerment in Saudi Arabia, relation to patient safety, how to be advocate, what are the tools that you can use, and what we are living and what we are having as a vision for 2030. Thank you so much.
Thank you so much, Dr. Samia, for an interesting topic, really. And I'm sure a lot of people really know a lot of facts about this great history of patient and health empowerment in our kingdom. Actually, we have a couple of questions and from our participant. The first one is from Hawa Muhammad. She is asking, from a nurse perspective, some patients refuse the medication or any plans that might harm them, and they will sign the refusal form, despite of the efforts of all healthcare providers. In this case, how can we deal with them?
Very good question. Very good question, Hawa. First of all, this is what we are talking about, patient engagement, right? Patient engagement and empowering with knowledge. Those who refuse, if they refuse a medication, if they refuse admission, if they refuse operation, the first thing you should understand and ask, why do they refuse? Is it ignorance of information? Is it misconception? Is it because they think that it will harm them? So first of all, you understand the reason and you discuss and counsel. Unfortunately, we don't give, I'm a physician, I'm an obstetrician, we don't give enough time for counseling, which is important. You should empower them with the knowledge, reassure them. If she is afraid that, like the chemotherapy, many of my colleagues, oncologists, they will refer them to me because being a doctor and being a survivor, and I had the chemotherapy, I know what's chemotherapy. So when she say it will kill me, or I will lose my hair, I will, etc., if they understand why we are giving them, what are the side effects, is it permanent, is it temporary, is it exaggerated, they will be reassured. Number two, which is a message that I give to everybody of you, in the by law, people, a lot of healthcare providers, whether nurse or doctors, whoever, for example, if you have a patient in the ER or in the ward, and the easiest thing for some of these providers is to bring the discharge against medical advice, refusal. And they asked the patient to refuse, those who refuse to sign. Even if she signed the paper, it does not protect you from the medico-legal problem. It does not protect you. You have to counsel her, counsel the family, bring another consultant for second opinion. The ethical committee should be involved. There are many ways, and I can reassure you, if she understands 90% or 95%, they will change their attitude. And be careful. If she signed, this doesn't mean that you are on the safe side. She signed. If something happened, well, my patient, she signed that she is responsible. This is not a protection to you, okay?
Thank you, Dr. Samia. I think one of our participants, she is really assuring your answer by saying that she is as a psychiatric doctor. They call her for consulting the patient who refuses treatment. And she said, I'm assuring them and sometimes give them psychotherapy, and they will accept immediately. So do you think it's a problem of a communication, Dr. Samia?
It's multi-factor. It's a communication, it's ignorance, misconception, and sometimes, as our colleague said, some of them, they have phobia from chemotherapy or from cesarean, and sometimes we need the psychiatrist to get involved. Not in every case, but sometimes if there is time. But unfortunately, like in emergency, for example, being obstetrician for emergency cesarean, if she refused, you cannot bring a psychiatrist mid of the night to discuss, because this is real emergency. And this is why the importance of empowering people with knowledge before they come in labor, through the clinic, through the empowering the community and the husband and the family.
That's great. Dr. Sami, allow me to launch the last polling. So our participant, you are invited to participate with us in the last poll. Just let me share and launch the last question. By empowering patients in their healthcare journey, we are the first option, reducing assumptions about patient, increasing their satisfaction about the service in the hospital, or providing the patient with full responsibility. So what do you think? And please, we need more answers. So we are more than 400 plus. We will give you a few seconds. I think, Professor Samia, we need more than one session about this really important topic.
Right. And for the, usually, by the way, the multiple choice, it's
tricky somehow. Yes.
Yes, it's tricky because, for example, now, when they 60%, they say it increased the satisfaction about the services. I agree in one way or the other. But at the same time, it reduced the assumption about the patient. So, in general, empowerment is emphasizing the rule that we need to avoid errors and mistake, and to reach patient safety, reduce morbidity and mortality.
It's really an interesting topic, and we still receive some more questions. They ask about what about doctora high-risk consent in emergency cases and patient unconscious? How they can deal with them?
Okay, the unconscious patient, if you have a patient, for example, car accident, and he is in coma or unconscious, or the lady, you cannot take a consent from him. And usually, if there is a relative, they will take the consent from the relative. If there's nobody with him, the two doctors, they will sign that it's an emergency. And even if there is no time to sign, and I put it in one of the slides, this is clear in the law of the Ministry of Health. In emergency, you do not have to wait for consent. You go without consent, because you might, for example, if the patient is in hemorrhagic shock, you might end with renal failure or death of the patient. You might lose an organ, or you might lose the patient. So دائما أنا أقول يعني I apologize for saying it in Arabic, because I don't know exactly the phrase in English, but let me try. In Islam, there are 5 important things, مقاصد الشريعة. If somebody knows how to translate, مقاصد الشريعة for all of us, the purpose of religious is to, one of the issue, which is the top one, to save lives. It comes before any other purposes. And in these emergency cases, to save life is a priority. To save life, you cannot discuss anything else. So saving life is a priority in every aspect. So the unconscious, in coma, you cannot have a consent. You go ahead with what you think is right. Two consultants will sign. Sometimes there is no time to sign. It's by law. You do not have the consent. You can have it later on.
Awesome. Doctora, we have another questions from an OB-GYN doctor. She is asking, do you prioritize a pregnant woman's choice to accept treatment or the father's choice to refuse treatment? Can the man file a lawsuit against the doctor?
Right. If I understand the question correctly, what I understand is that if you have a patient, she refused, for example, no, she accept or she refused.
She accept, doctora. She accept the treatment.
But the husband refused.
Exactly.
Right. There are many issues in this case. First of all, if she is 18 years and above, I don't need the approval of the husband. I do not need the approval. Go to all the laws of the Ministry of Health. You will find that adult woman in Saudi Arabia, this is the by law, she is the only one who can sign for herself. This is number one. Number two, I know that husband might sue you, and sometimes, unfortunately, I'm saying unfortunately, some of the courts in Saudi Arabia still, they are not updated enough with the regulations and reforms that give the mother these rights. So they think that the approval of the husband or the father should be taken. This is completely wrong. This is completely wrong. I will give you another example as well. Even in termination of pregnancy in Islam, طبعاً, we do not have abortion except through a small window for certain medical indication, if there's a threat to the mother health or life. And in these cases, if you have a lady and, for example, she has type of cancer and she has to have termination of pregnancy, continuation of pregnancy will affect her health or life, and the husband refused, you don't ask the husband. You go with what is the decision of the lady. So it's a big issue, but it's the adult woman who is the only one who can sign. What's happening in reality, in practice, to be honest and fair, unfortunately, we are, some of us, raising our daughters in a different way. still the reform is going on. Like my daughter today, she is not living the same life I used to live when I was her age. Now the young generation, they are smart, they know about their rights. So you have to keep this in mind. But some areas, some families, some ladies, when I tell her, for example, you need this operation, immediately she will tell me, 1 second, I will call my husband so that you explain to him. I usually ask her, I will explain to him, but I need your opinion. She said, no, I cannot decide. Why? Because she is afraid that he will pressurize her. And this is why all these rights, there should be no violence or pressurizing the patient. I hope I did answer your question, because in obstetric and gynecology, it's a very good area to learn a lot of health rights. Maybe one of the most branches that you need to know about the rules and the regulation. And by the way, there is a book issued as a reference. I wish I put it in the slides. A manual of consent in Saudi Arabia. If you go to the website and you write it through the, as well, our e-learning program, or through the website of the Ministry of Health, you will find that booklet. It's an excellent one.
Thank you, Doctora. You are right. We have a lot of complicated cases with pregnancy. We are reaching to the last question, which is we have some really participants who are really interested to become a health empowerment ambassador. What are the mechanisms so they can join your team?
Very good. Now I'm working as a consultant for health empowerment with the Saudi Society for Health Specialization, and we are planning to have it for the, this is in 2022. We are, I'm going to propose this for the healthcare providers. The other one is for the students, and this is in Faculty of Medicine, King Abdulaziz University. I'm not working now because I've retired 2 years ago, but I'm just teaching the health empowerment module for the students. So you can either reach the courses. There are advertisements about it, and sooner, maybe the coming few months, we will announce about the ambassador. Anyone, senior or junior, can join, and especially those, the junior, who can work hard with us to gain experience and to gain volunteer hours as well.
Thank you, Doctora. We are really lucky with having this passion from your talk and from your efforts. On behalf of Saudi Patient Safety Center, we would like to thank you, Professor Samia Al-Amoudi, and the audience for their active participation. And as a part of Saudi Patient Safety Center effort to provide you with the timely topics and interesting speakers, we would appreciate if you would fill out the evaluation survey provided in your email, so you will receive your certificate as well. Thank you for joining us today, and we look forward and welcoming you back in the future webinars. Any last thought, Professor Samia, do you have to add?
Yeah, of course, I would like to thank you. I'm very, very grateful to give me this chance and to hear this discussion. And I always say that from my side, as a founder of the Health Empowerment, I'm ready to answer any question 24 hours a day, and I will give you my phone number for the WhatsApp. Anybody who have a question, just please text me in the WhatsApp and tell me that this is a question regarding so and so I could answer. And my email, Makia can put it. My phone number 0505 626 I'm available and I'm ready for anything regarding health empowerment, anytime, day or night. Thank you so much.
Thank you so much, Doctora. and good night to all.
Good night. Assalamu alaikum.